Welcome to the Beauty Blueprint with Dr. Roy Kim, the ultimate guide to exploring all things beauty, aesthetics, and procedures. Whether you're curious about the latest advancements or seeking expert advice, renowned plastic surgeon Dr. Roy Kim has got you covered. Join him as he engages in insightful discussions with industry experts, sharing his expertise to empower your aesthetic journey. Make sure to subscribe to stay updated and enhance your confidence with a wealth of knowledge. In today's episode, we'll cover a range of topics related to beauty, aesthetics, and procedures with plastic surgeon Dr. Roy Kim, including non-invasive and invasive procedures, industry insights, aesthetic advancements, and fostering an empowering aesthetic journey.
Have you ever heard of the term internal bra? You may have come across it in discussions about breast augmentation and lift procedures, but what does it actually mean and how is it different from the invisibra? Let's dive in and explore. The concept of the internal bra has been around for quite some time within the plastic surgery community. It was created to address the issue of sagging breasts after a lift or augmentation surgery, particularly when implants are involved. Essentially, a sling or hammock is fashioned at the base of the breast to prevent the implant from slipping and sagging down towards the abdomen. This helps to maintain the youthful shape and position of the breast for a longer period of time. Interestingly, the use of the internal bra concept isn't limited to breast augmentation. Even if you just undergo a breast lift, the same technique can be applied to prevent the lower areas of the breast tissue from sagging and losing its lift. In the past, breast lifts didn't always yield the desired results, with noticeable sagging appearing within just a year or so. However, the introduction of the internal bra concept has helped to combat this issue, leaving patients with rejuvenated and lifted breasts for a longer period of time. Now you know the ins and outs of the internal bra and why it's such an important technique in breast surgeries. We're all familiar with the concept of an internal bra, but the invisibra concept takes it one step further. Early versions of the internal bra were sometimes unreliable, causing unpredictable breast positioning, and sometimes even making the absorbable mesh product used to reinforce the bra palpable through the skin. But through refined surgical techniques and years of experience, the invisibra was born. The invisibra is a tailored and multiple approach to achieving long-lasting results without any noticeable internal support. Patients can receive the support they need without feeling anything on the outside. So, if you're looking for a way to enhance your breast that's reliable and subtle, the invisibra might be the answer you've been looking for. Have you ever heard of the term internal bra? It's a technique that plastic surgeons have been using to help women who struggle with breast sagging. Before the development of the internal bra technique, surgeons would use a patient's own body tissue near the breast fold to attempt to remedy the issue. In cases where the patient had breast implants, the surgeon would utilize the scar tissue or capsule around the implant to support the breast fold with a procedure known as capsulorrhaphy. Other times, surgeons would use the fascia of the abdominal muscle to create an internal sling, which is slightly stronger than the previous approach. However, even this method wasn't always effective in the long term. This is where the internal bra technique comes in. It involves using a mesh material to create an internal support structure that helps to lift and maintain the position of the breast. And while these previous procedures may have worked initially, many patients would still experience recurrent breast sag soon after surgery. So, the internal bra technique has been a game changer in the world of plastic surgery and has helped countless women achieve the look they desire. The next internal bra, version 2.0, was invented using ADM. Plastic surgeons began using a material called acellular dermal matrix, or ADM for short, to support the lower breast fold area. Essentially, ADM is made from cadaveric animals or humans and is treated for viruses and other pathogens. Once sterilized, it's placed as a sling or internal bra in the breast fold to hold the breast tissue together, prevent sagging, and support the breast implant. While ADM is definitely a game changer in the world of breast surgery, there are a few issues with it. For starters, it can be quite expensive. Additionally, the flexibility of ADM makes it hard to predict exactly where the new breast fold will be after 12 months. This is because ADM is so pliable and flexible. It's great in certain situations, but not so much in others. So what's the deal with ADM now? Well, while it's fallen out of favor in cosmetic surgery, it's still a lifesaver for many breast reconstruction cases. Unlike other options, ADM has a few unique advantages that make it a great choice for these types of surgeries. All in all, ADM is an innovative tool that doctors are using to help women achieve their ideal breast look. Whether you're undergoing breast reconstruction or a cosmetic procedure, the use of ADM may be a possibility for you. Next up is internal bra option, version 3.0, that can help you achieve youthful and perky breasts. Sounds good, right? So let's dive into the details. We're talking about barbed sutures, which are special types of sutures that are difficult to move once placed. They come in handy when you need to access hard-to-reach areas, and they help create scar adhesion for the lower breast fold, which in turn helps prevent the breasts from sagging. But here's the thing, even with an option like barbed sutures, using just sutures alone typically isn't enough to support the base of the breast for an extended period of time. So if you're looking to enjoy life with perky and youthful breasts, the barbed sutures and internal bra option version 3.0 is an option in some patients, but not all of them. Have you heard of the latest and most robust material used to create an internal bra, version 4.0? We can use absorbable mesh to create an internal sling for the breast. A common chemical is called PH4B, or poly-4-hydroxybutyrate, and it's a chemical substance turned into a mesh that can be flexible or stiff, depending on how it's manufactured. What's really cool is that this material is absorbed by your body over time, so no need for removal surgeries. In fact, once PH4B is set in place, it will not settle, rise, or change position, making it highly predictable for breast fold placement. Plus, it's more cost-effective than other materials and comes in various sizes and shapes. The US brand name for PH4B is Galaflex. Another option for an absorbable mesh is PDO or polydioxanone, which is a different chemical than PH4B but still gets absorbed by the body. The brand name for PDO is Durasorb. Can you imagine how great it feels for plastic surgeons to know that as soon as they set the absorbable mesh in place, the breast fold position is locked in and will not move? There's no need to rely on time and healing to see the end result and final position. It's also possible to make the left and right breast folds symmetric, knowing that they will stay that way over the long term. In short, PH4B and PDO are two newer, fantastic options for creating an internal bra that ensures predictable and long-lasting breast fold placement. Let me tell you about the Invisibra concept. It's a multimodal, sophisticated solution for women who seek comfortable and discreet support for their breasts. Now, you might wonder, how does the Invisibra concept work? It's actually quite simple, yet very effective. I take into account your unique anatomy, breast and skin tissue, and the thickness of your tissue to tailor a custom solution just for you. We can create an internal bra structure using your own tissue, or barbed sutures, or absorbable mesh, or a combination of all three choices. The result? Support that is long-lasting, predictable, and difficult to feel. The beauty of the Invisibra concept lies in its power to provide discreet and comfortable support for women without compromising on style or fashion. With Invisibra, you can be confident about how long your breast surgery results will last. So, are you ready to experience the power of the Invisibra concept? So, let's talk about the Invisibra technique and how it's used in breast lifts. Now, as you may already know, an internal bra of some kind is really important when doing a revision breast lift. It can give the patient the best chance of avoiding any repeat sagging down the line, and that's where the Invisibra comes in. It's a really effective way to make sure the lift lasts a long time, especially when a breast implant isn't being used. This technique is definitely something worth considering if you're thinking about a breast lift and want to make sure that your amazing results stick around for as long as possible. The Invisibra technique is particularly helpful for patients who want a breast implant and breast lift, or a heavier, larger volume breast implant during an augmentation. We all know that the larger and heavier your breast, the quicker it may sag over time. Creating a customized Invisibra will give you a more rounded shape at the base of your breast and greater assurance that your breast implants will not sag or put too much pressure on the lower part of your breast lift. Essentially, the Invisibra technique provides support for the breast implant and tissue, which ultimately results in a much longer-lasting outcome for the patient. Having this extra support can make all the difference in achieving the desired results and ensuring that the patient is satisfied with their decision to undergo these procedures. It's always exciting when new techniques and technologies become available to help us improve upon existing procedures, and the Invisibra is certainly proving to be a game changer in the world of breast augmentation and breast lift combination procedures. The Invisibra technique is becoming increasingly popular for breast augmentation, especially for patients with thinner and more lax skin. I have used this technique on some of my patients with these tissue characteristics and plan to use it more consistently. So let's talk about the future of the Invisibra technique. If you're a patient who's considering a breast operation for the first time, or maybe you've had the procedure before, Invisibra might be able to offer you more certain and longer-lasting results. In fact, I predict that in the next few years, this approach will become the standard of care for patients who want a breast lift, breast augmentation, or even a combination of both. So why is Invisibra gaining popularity? Well, it's all about achieving a more secure overall appearance with less chance of sagging in the short term. Simply put, it's a technique that can give you better and longer-lasting results.
In today's episode, we explored various topics in beauty, aesthetics, and medical procedures ranging from invasive to non-invasive, while getting industry expert insights and fostering an empowering aesthetic journey. Thanks for listening to today's episode. I'll see you guys at the next one, and don't forget to subscribe to the Beauty Blueprint podcast, hosted by none other than Dr. Roy Kim.